All right, so my name is Michael Messer, and I had my project on health information technician. So I'm gonna go ahead and start sharing my screen and get started. Um, all right, so we should be able to go here. Okay, so um, this is my poster talking about health information technicians. Um, what does this profession do? So basically, they're just creating connections and helping people within the healthcare community transfer data and create things more affordable and efficient. With doing that, they're honestly always moving data around and they're communicating between people at the hospital, the healthcare professionals, the patients, and the insurance companies to figure out how to make things um, the best for all three to work together as one. So that's kind of what the goal of their profession is, um, and they just have to know a lot of information about coding and uh, basically sorting this type of information within the healthcare systems, so it's ready and available for whoever may need it at whatever time. So it's almost like an online file of all this healthcare data, and they help to communicate and create the best outcome between those three parties. The requirements for this career are going to be having a bachelor's degree in healthcare information management, or some type of similar healthcare field that relates to that. And they're also going to have to pass an exam that is ran through the American Health Information and Management Association. So they're going to have to finish that to be able to have this career. Um, so I kind of want to move over to, I know I'm kind of jumping around a little bit, but I'm going to jump over to the central nervous system. I know I had organization of the human body, but I wasn't exactly sure which way to go with that. And I kind of figured that the central nervous system would be something that everything has to go through. You know, it's kind of how all of our bodily functions work, and how our body just functions as a whole. It all kind of goes through that one central thing. So the central nervous system is basically just composed of the brain and the spinal cord. And like I said before, it's going to be um, controlling your bodily functions, which when it comes to health information technicians, um, this is going to include like your thoughts, your speech, and your memory, because you have to know a lot of these codes and you're going to have to be able to use your words to communicate. I know it's a little difficult to see um, the anatomical structures, but basically that's just labeling three different parts of the brain and um, the spinal cord, which is what everything goes through for the central nervous system. So the way that works is basically it takes the senses of the body and responds accordingly, sending different movements or commands through from the brain to the rest of the body through the spinal cord. Some facts that I wrote about the central nervous system was one I thought was cool was the human brain alone consists of about 100 billion neurons, which is insane. And another one was that in a child developing inside the womb, those neurons are growing at a rate of 250,000 neurons per minute. So it's kind of cool to see how that develops as the fetus is getting ready to be born. Um, so for jumping into back into health information technicians, it's kind of crazy to see how that health information technology has changed so drastically in recent history, just because of the increase in um, technology that we have and how much that continues to grow and evolve. So that's always changing on a daily basis, depending on the newest and best, fastest, most updated technology that we have. So for a health information technician, there's a lot of medical terminology that has to be known and a lot of coding that goes along with that. So that's where that degree kind of comes in and helps you know the codes that you need to know and that's how they kind of are able to keep things organized through coding and knowing all that medical terminology to keep it all in the right files and make it easy to access. Um, and the last thing is, although there's skills for coding and keeping records and stuff is really important, I think one of the things that's kind of downplayed is the communication you have to be able to do this job. You're going to have to communicate with patients, medical professionals, and insurance companies and make sure that all those three parties are communicating with each other as well, to be able to do that job as efficiently as possible. Um, so communication is another huge thing. So at the end of the day, these health information technicians are just there to keep that communication going, keep everything organized. And it's almost like the behind the scenes type of people that really keep that stuff running efficiently and the way that it needs to go. So um, I have another slide just for my references. So that's that. I know it was supposed to be on a poster, but I probably would have wrote this on the back of the poster if it would have been in person. So I decided to just create another slide for that. Um, so yeah, that's the end of that, and thank you.